Hi, class. Let's talk about some of the disorders that are commonly seen with the neural system. One of them is neuritis. Now, we see the word itis here. So whenever we see the word itis, remember that means inflammation. So when you have inflammation of the nerves, that's neuritis. And that can be caused by any injury, but could also be caused by a vitamin deficiency or toxicity, especially B6. You'll see this with B6. If people take too much of B6 or too little, you can get a type of neuritis. Sometimes people have a deficiency in B6, B9, and B12. These can also increase homocysteine levels that can create a type of neuritis. So we have to look out for that. Shingles, this is an infection of the peripheral nerve by the chicken pox virus. It's called herpes zoster. It's a part of the herpes family, herpes zoster, and it causes intense pain. The skin can be discolored. You get these very, very small, almost like microscopic blisters. I've seen many patients over the years that have told me that it feels like black and blue on the back or in the lower back or along the ribs. And then when we shine a light on it with a magnifying glass, you could really see a very, very tiny, small blister. And that's how it starts. Polio is a viral infection, and polio is a viral infection that attacks the anterior horn cells. Remember when you look at the spinal cord and you have the gray matter here? These are the anterior horn cells. Back here, these are the dorsal horns. So when a virus attacks the anterior horn cells, and this is where all the motor output comes from, you get motor neuron death. And the motor neurons going to the heart can create cardiac failure. The motor neurons going to the lungs can create respiratory failure. Okay, we did speak about sciatica, which can come from a subluxated or misaligned vertebrae. It can come from arthritis or type of osteophytes and spurs of the spine. It can come from a disc bulge or disc herniation, tilting of the pelvis, a tight piriformis muscle, curvature of the spine or scoliosis, having decreased lumbar curve caused military spine, or an increased lumbar curve, hyperlordosis, or flat feet and pes planus. All of these can cause sciatica. When we look at CTS or carpal tunnel syndrome, this affects the 3.5 fingers, the first, second, third digit, and half of the fourth digit. When there's carpal tunnel syndrome, there are two tests that can pick it up, signs. One is Tinel's sign, and the other is Fallon's test. Tinel's sign is when you tap over the volar ligament or the flexor carpal ligament or the flexor retinaculum. When you tap over that with your finger or a reflex hammer and you get shooting pain down 3.5 fingers, that's a positive Tinel's sign. Fallon's test is when you hyperflex both your wrists together so that the dorsal side of each of your wrists is touching one another, and you hyperflex the wrist and you get shooting pain to 3.5 fingers. That's a common finding for carpal tunnel. But the gold standard is a needle EMG. And the needle EMG is when they put a needle on one side of the flexor retinaculum. So let's see if I could draw this out. Let's say that's your thumb, second digit, third, fourth, fifth digit, and there's your wrist. So let's say here is the flexor retinaculum. They put a needle here, and then they put a needle on this side. And they send a shock, and they measure how long it takes to go from needle 1 to needle 2, because it's going through this carpal tunnel where the roof of the tunnel is the flexor retinaculum, and the floor of the tunnel are the carpal bones. okay? Another name for the flexor retinaculum is the transverse carpal ligament. So this is the roof, and the bottom is the carpal bones, and the tunnel is everything that runs through it. And you're going to have the nerve that goes through it, the median nerve, the 3.5 fingers, and you're going to have all the flexor tendons that go to the digits. So if the finger flexors are overused and the tendons become thicker, then the space within the tunnel gets smaller and the median nerve gets compressed. So they put a needle here, they send an electric shock, they measure how long it takes to go from needle 1 to needle 2, and let's say it should take 1 second, and let's say it takes 3 seconds. We know the compression is happening here. If it should take 1 second and it takes 1 second or less than a second, then it means the compression is happening someplace proximal to that, maybe the elbow or the shoulder or the cervical spine. So that's carpal tunnel syndrome. TOS, thoracic outlet syndrome, this is when the brachial plexus and or the subclavian artery is being compressed by the scalene muscles in the neck or the pec minor muscle. Okay, remember the brachial plexus from the neck travels under the clavicle and down the arm. Now, when it travels through the neck, it gets squeezed between the scalenes. Remember, you have the scalenus anticus, medius, and posticus. And it's underneath or deep to the pec minor. So there are 2 tests, Adson's test and Wright's test. When you do Adson's test, that's designed to stress and bring out the scalenes as the cause. And when the pec minor is involved, that's Wright's test. So the scalenes, when you turn your head to the right and you look up and you take a deep breath, and the examiner is feeling the pulse on the right hand side, on the radial pulse, if the pulse diminishes, it tells us that the right subclavian artery is being compressed. If the patient turns their head to the right, looks up, and takes a deep breath from their mouth, which activates the scalenes, and the pulse is fine, but the patient feels numbness and tingling down their arm, especially the inside of the elbow, then it means the scalenes are compressing the brachial plexus and the lower end of it, specifically the C8 and the T1 area. And when you look at the C8 and T1 dermatome, you'll see that it's the inside of the elbow and the inside of the forearm and the pinky and half of the ring finger. When it's Wright's test, remember the Wrights made the airplane, the Wright brothers made the airplane. So if you hyperabduct the arm and the shoulder and you raise it above the arm and the hand above shoulder level, out to the side, way abducted, and the pulse diminishes, then it means the pec minor is compressing the subclavian artery. If you raise the arm way above the shoulder, raise the hand way above the shoulder, abducted, and the pulse isn't diminished, but the person gets tingling into the pinky and the inside of the forearm, then it tells us the pec minor is compressing the lower end of the brachial plexus at C8 and T1. So the thoracic outlet syndrome could either be the scalenes syndrome or pec minor syndrome. And it's either pec minor and the scalene muscles compressing the brachial plexus and or the subclavian artery. And the Adson's test and Wright's test differentiates which is the involved structure that's doing the compressing and what's being compressed.